Okay, so hi there, people. Peace. This is my first video, and I'm going to tell about the maxillary artery. Now, for the first thing, maxillary artery. Maxillary comes from the word maxilla. What is the maxilla? Maxilla is your upper jaw. As you can see over here in this skull, this part is your maxilla. This is your mandible, and this is green part is your maxilla. Okay, and for the artery, I mean, come on, you all guys know what an artery is. A blood vessel that carries blood from the heart to the different parts of the body. Now we're going to go to the parts of the maxillary artery. Now, before we go there, first, from where does the maxillary artery come out from? This is your aorta. This comes out from the heart. This is the largest artery in your body. From the aorta branches out three branches that are main branches. From one side, that is the left side, you get the common carotid artery, that this is, and the subclavian artery. And from the right side, you get a brachiocephalic trunk that leads to further the same subdivisions, which are the common carotid and the subclavian. This is so because the aorta is supposed to be situated a little bit more left on our chest. That's why it needs a brachiocephalic trunk to travel further and then divide into the common carotid and the subclavian. Okay, so from this common carotid, the common carotid artery goes up to about the thyroid region of your neck, and it divides into two different arteries, which are the external carotid and the internal carotid artery. Now, maxillary artery is a branch of the external carotid artery. Here we go. This is the aorta again, and here we have the common carotid artery, and here are the branches. This is the external carotid and this is the internal carotid. This external carotid divides into many branches, which I can explain to you further. There might be many branches like the lingual artery and the superior thyroid artery, which supplies the thyroid gland, etc. Anyway, here is the maxillary artery over here, and here we have the facial artery. Okay, so as the maxillary artery moves on, it has three parts. Yes, you see, first part, second part, and the third part. The first part goes near to the lateral pterygoid muscle. The lateral pterygoid muscle is a muscle that is your masticatory muscle. It helps you to chew and your mouth movements. It is situated over here near your mandible and your maxilla. As you can see, this is the lateral pterygoid. Lateral pterygoid has two heads, the upper head and the lower head, and the maxillary artery, the first part of the maxillary artery passes near to and forwards to the lateral pterygoid muscle, and then it starts a second part when it starts passing superficially or on the lower head of the lateral pterygoid muscle, and the third part moves on as it leaves the muscle and as it goes between the two heads of the lateral pterygoid muscle, and the third part moves further, and the further branches that come out of the parts. Okay, so the first part has 5 branches, which are the deep auricular, which supplies the ear muscles and the parts of the tympanic membrane. The second one is the anterior tympanic, which also supplies near the ear. The third and the fourth are the accessory meningeal and middle meningeal arteries. They supply the meninges and the infratemporal fossa and the different parts of the temporal region. The deep auricular artery supplies the temporomandibular joint. This is your temporomandibular joint, the part where your mandible is attached to your head, to your occipital bone in your skull. The way your mandible moves is through the joint. Anyway, the last branch of the first part of the maxillary artery is the inferior alveolar artery, as you can see over here. This artery supplies your lower jaw teeth and all that. Okay, this is a little bit more difficult diagram, but don't get scared. This is just a little complicated. It's the skull over here, the mandible, the teeth, and this is your external carotid coming, and this is the maxillary artery. I just wanted to show you the inferior alveolar artery, how it supplies. This is the inferior alveolar. As you can see, it is branching into two over here, just above this part. The one part is going to the mylohyoid muscle. It supplies the mylohyoid muscle. The other part moves on through the mandible, and it goes on to supply the teeth, and it goes in the mental foramen. This is the mental foramen, and it comes out as the mental artery, which supplies the mentum. Mentum is your chin, so this supplies your chin as well. Now for the second part of the maxillary artery, its branches are usually muscular branches, that is, they supply the muscles. It has only 4 branches, as you can see, 1, 2, 3, and 4. The first branch goes to the masseter muscle, which is also a masticatory muscle. It helps you chewing and your mouth movements. It is the masseteric artery. And the second one is the buccal artery, which supplies the muscles on the skin of your cheek, as it says buccal. Buccal is your cheek. And the other are the temporal artery, which supplies the temporalis muscle. Temporalis muscle is a muscle located in your temporal region of your skull, and it also helps in masticatory processes. And the fourth one is the pterygoid artery, which, as I said, this is the lateral pterygoid muscle. There is a medial pterygoid muscle as well, and it supplies both medial and lateral pterygoid muscles. Now the third part is quite complicated. It has 6 branches. That is the posterior superior alveolar, which supplies the posterior teeth of your upper jaw, the infraorbital, the greater palatine, pharyngeal, the artery of pterygoid canal, and the sphenopalatine artery. Can you see that? This is the posterior superior alveolar artery. It is again coming from the external carotid, the maxillary artery, and the third part, which is after the muscles, is coming over here. Superior alveolar artery is posterior. This is the posterior, and it is going to supply the teeth. Alveolar means the alveola is the part of the bone which holds your teeth, so that's why it's called posterior alveolar. And it is posterior because it's coming from the posterior side. Anterior side would be coming from the anterior, that is the front. Posterior means the back. So this is how it supplies. Now the infraorbital artery, which is the branch of the third part of the maxillary artery, as you can see here, this is the infraorbital artery. It's called infraorbital because infra means the lower side, and orbit is the place where your eye is placed. This is your orbit, and this is the inferior side of your orbit, so infraorbital artery. It actually forms different branches. That is the middle alveolar superior alveolar artery. You see, the posterior superior alveolar artery was coming from a different branch of the maxillary artery, but this the middle and the anterior superior alveolar arteries, they come from the infraorbital part. and they supply the incisors and your your frontal teeth. And further on, the infraorbital artery goes on to the nasal area or the lacrimal area. Lacrimal is in relation to your tear glands, and it supplies the lacrimal apparatus as well. It also goes through the infraorbital foramen. I forgot to include that. Now for the next one, that is your greater palatine artery, which is also a part of the maxillary artery. This is your greater palatine artery, as you can see over here. This comes down to your maxilla, to your hard palate. Hard palate is the upper hard part inside your oral cavity, inside your mouth. And it comes along over here, and it goes into the greater and lesser palatine foramens, that is the holes or cavities, and it forms the left and right greater palatine arteries and left and right lesser palatine arteries respectively, as it goes in different foramens over here on the back of your hard palate. This is your pharyngeal artery. This is also a part of the third part of the maxillary artery, and here, as you can see, it's going over here. Okay, and it supplies the pharynx, of course, that is the connection between your mouth and your nasal cavity. The other parts are the pterygoid arteries, which go through the pterygoid canal, and the further one is the sphenopalatine artery. The sphenopalatine artery, as you can see over here, it goes up into the sphenopalatine. A minute, I'm really gussy over here. Okay, so it runs through the sphenopalatine foramen to enter the cavity of the nose, and then it gives off a posterior lateral nasal branch over here. As you can see, it's going off branch, and then it goes further and gives some posterior septal branches. They're not much important, just except that the anastomose, that means they come and meet the palatine arteries through the incisive canal. The incisive canal is a canal just above your incisor teeth in your maxilla, and they meet with them, and that's about it. And I think we are done with the maxillary artery over here, and I'm not sure if you really enjoyed this or had any help with this, but I hope it was a help to you. The books I used are the Frank H. Netter's Atlas of Human Anatomy, and B.D. Chaurassia's Human Anatomy, as you can see. And well, it is 6:06 a.m. over here, and I am currently done with the maxillary artery. So laters.